because in Nigeria, the old are not spared, the young are not spared, the very young are not spared.
Yeah.
So there must be something that that we're missing, something that we're not doing right, something health-wise that is wrong with us. But did you know that 4th of February was celebrated the world over as World Cancer Day? Some of you might be wondering, is it not October? No, October is for breast cancer specifically, but February 4th is for all forms of cancers, World Cancer Day, all forms of cancers. And it's not just breast cancer. There's cervical cancer, there's cancer of the skin, there's cancer of the eye, there's... Just name them. Just name them. There are all sorts of cancers. We have experts in the studio with us who would let us in on those kind of cancers, how you get them, how you can be protected, how you can keep yourself healthy, and what to do when you're diagnosed with cancer. There's a lot of myth around it. A lot. People say, no, this one is a gargaja. Magani Buturi by our Kaddish. Going to the Orthodox hospitals will not handle it. You need to go the traditional way. And sadly, a lot of complications have arisen from those kind of thoughts.
Sure.
So our experts will do justice to that. I think they would just answer most of our questions, put to rest those myths that we have concerning cancers. And then, the more we know about it, I think the better protected we are. They say, what you don't know won't hurt you, but this time around, what you don't know will definitely kill you. So it's best you know about it. Kendra will do us the honors of introducing our guest.
Well, we decided on the Baroness to bring you a powerful duo to do justice to this topic. We have experts, one from the medical field and one who would generally just talk us through the activities of the Cancer Awareness Month here on the plateau. We have the National Coordinator, Civil Society for Cancer Advocacy and Prevention, CISCAP. We have Tokbish Yohanna Mizak. It's a pleasure to have you on the house, sir.
Thank you very much.
Thank you for being here. We equally have a nurse and public health epidemiologist and also president of the Rotary Club of Nigeria, Nicky Mariah Sambo. You have a lot attached to your name, seriously, and I'm glad that you're a female. It just says that what a man can do, a woman is doing better. It's a pleasure to have you on the Baroness, ma'am.
My pleasure meeting you.
All right. I'd like to kickstart this with the very question. We might think this question is simple, but a lot of people, it will surprise you that it keeps confusing them. When we talk about cancer, a lot of people just think there's just one cancer. So when we say cancers, they begin to look as though we're making mistake in English. So talk us through a bit about cancer. Let's know something about the disease. Doctor, you?
All right. Thank you so much. Cancer is an abnormal growth that occurs in the system. The body normally has cells, and the cells normally have something we call the cell cycle, in which it controls how the cells proliferate, that's how they grow, and how they die. But in terms of cancer, it shows that the cells grow with abnormal size, with abnormal shape, and most times they refuse to die. That is why most times you see that there is a growth on the tissue, and this growth can also move to many parts of the body. It can start from part A and move to part B, C, D, and the entire body if care is not taken. So cancer is just an abnormal growth in the body, and it can begin from any part of the body.
Okay, what are some of the most common ones? The common cancers that affect people in society.
Yeah, we have cancers that affect mainly women, and we have those that affect men, and we have those that affect everyone. For the women, majorly, we have the breast and the cervical cancer that affects majorly women. And cervical cancer is only found in women because women have cervix only.
Okay.
But that of the breast cancer, you can also see it in men, but it's very, very rare. But men also can come down with breast cancer. While in men, we have prostate cancer that is unique to them. We have more of men with also colon cancer compared to women. We also have cancers that can affect the mouth, it can affect the eye, it can affect the ears, can affect the nose, the skin, and whatever. And another common one that is coming up now is liver cancer. We have liver cancer mostly coming down with liver cancer is because of hepatitis C and hepatitis B infection. So that is why some of these infectious agents have now been colonized in humans that are coming down with some of these cancers, and we can say that, okay, they are now part of the predisposing factors to cancers in our body.
So if you can handle them, that means that
yes, you can reduce your risk of cancer of that organ.
Okay.
Yes.
Okay. Now, we have noticed recently that it cuts across all ages. What could be the cause?
Yeah, it cuts across all ages because the number one cause of cancer is unknown.
Okay.
That is the number one thing.
Okay.
Then secondly, we have genetic predisposition. When there is a family member that has been diagnosed with cancer, bringing the issue of Jennifer Lopez, when she discovered that she has the genetic predisposition because it was in her family, so she had to do mastectomy, that's cutting off the two breasts at once so that she won't come down with the breast cancer. Yes. Wow. So that was a preventive kind of thing that she did. So we see it in all ages because some people have genetic predisposition. And if you look at our environment now, it's not the way it used to be. Just for example, I was telling somebody last week that I missed the Harmattan in Jos because this is not our normal weather. Despite the fact that strangers can tell you that Jos was cold, but we in Jos knows that we didn't experience Harmattan the whole of January. So we miss that weather. You can see that the weather is changing. So that can also predispose us to some of these things. And the kind of work we do now, it's not the way it used to be in those days. The type of factories we have, the type of cars we have, the emissions we are getting from some of these factories and vehicles, they were not there in those days. So all this is predisposes us. And sometimes you look at the kind of lifestyle we live at the moment. Most of us now are living sedentary lifestyles. We sit in one place for too long. Our children watch TV, they play indoor games. Going out to play is a problem. So sedentary lifestyle even begins from childhood at the moment now. So you see the rate of obesity now is becoming something else. So childhood obesity, you see that is becoming more rampant than it used to be. So that is also predisposing people to cancer. And some of these infections that we are now getting in our environment that they were not there in the times of our forefathers. So these are predisposing us to cancer, and also our diets. Most of us prefer processed foods. So if we can also reduce that, some of these processed foods, you are not sure 100% that if this thing is genuine or not, or some of the chemicals that have been added are carcinogenic or they are not carcinogenic, or is the producer telling you exactly what is in that food, what actually he or she used to preserve that food, and also the container in which that was used to preserve such a food. So these are the things that are predisposing us to cancers at the moment.
You know, I'd like to come back to you, sir. You know this popular saying that ignorance is bliss. Actually, it might not be the case when it comes to cancer. And maybe you might have a totally different opinion based on that statement. But let's come back to it, sir. You deal with awareness, trying to ensure that people know about these cancers and how to prevent them in society. Now, talk us through the Cancer Awareness Month. Why the month of February, and why should there be more sensitization on it, sir?
Welcome, viewers. Month of February was earmarked as World Cancer Day, comprised of all the types of cancers. Not just February, but if you look at other months, most of the cancers have been segmented on different months, like the October and January is cervical cancer and other months like that. But they felt February should be the one for the entire types of cancers. And at that month, globally, people go out to talk about cancer issues, that they create awareness in different forms. Through the media, community outreaches, advocacy to stakeholders, and ensure that people key into the month. So we did a lot in the month of February, especially that 4th. There was an awareness rally from the Secretary General to the Commissioner's office, where he made a public flag off and press briefing of the cancer situation in the country, globally in the country, and then that of Plateau. So that one was there, and we felt we could just continue the awareness. This awareness in February is something that need to be done, because people, they say my people are perished because of lack of knowledge, isn't it? So we need to intensify this awareness to different groups. As it is, as from that fort, we've been going to schools, been going to secondary schools. In fact, we had planned to go through about close to 15 health tertiary institutions. The nurses, those in the colleges of health and the rest, because if we sensitize and train them, we believe that they will carry out the message down to the grassroots. We have a system of trying to pass this information down to the grassroots through the trained health workers, the students, because at the point they are posted to all the clinics in the rural and the urban communities. Now, if a nurse is being trained on early cancer detection, just like this breast cancer, let me make use of a breast cancer examination. If a client goes to the hospital for a different condition, and the trained nurse happen to see a sign of breast cancer, she will now advise her, after attending to her, on what brought her to actually go and assess the cancer screening, because she had what? Identified a sign on her. So we felt that if we train the health workers, we have trained the whole nation. So that is our strategy for the month. We're expanding this awareness down, and we're also thinking about bringing in the wives of the local government chairman. They are key stakeholders in the movement, because they are women leaders. We're talking about bringing the NAOA, NAPOA, all these women groups in the military, paramilitary, because they have hospitals in their communities. If we bring these people and brief them, bring the chairman and brief them, the councillors and brief them, they will go back to their communities and begin to intensify the awareness down to the grassroots. By so doing, it will be an advantage to the cancer zonal center that we have on the plateau today. Some people may not know, but very soon it's going to be a kind of everybody's thinking about it, because if they come to commission the center, the president of this country was able to create 6 cancer centers in the whole country, and that of North Central is in Jude, Plateau State. So part of our awareness is we are telling people that look, they will be no more going to Kano, Sokoto, Ibadan for cancer cases again. Very soon we are going to have it. In fact, the centers are like 95% completed in Jude. So part of our awareness is to let people know that we have a center already. Let us try to know the different types of cancers, signs and symptoms, so that when you notice one, then you rush back to the hospital for that.
I'd like to interject a bit before you go a bit further. You mentioned schools, and usually parents have certain concerns, or might have certain concerns, because usually back in the day, it would be quite difficult for parents to tell kids about a lot of issues, feeling like they're too young, they might not have the capacity to understand, it might create fear and certain stigmas and all that. So do you actually think that children in schools, as young as they might be, should be taught about things like cancer? Aren't they too young for that?
They are not, because my colleague had talked about some cancers that are like almost on every age group. Like the cervical cancer, we have what we call the human papillomavirus vaccines that was launched by the National Primary Healthcare and even the State Primary Healthcare Agency. So in 2023 and 24, even 25, it was an open ticket for all girls 9 to 14 years to have that vaccine free of charge. And the vaccine has been tested, reliable, cheap, and available then. Now, at the moment, it has been restricted to age only 9 to collect that vaccine. Those that were 8 then, they are 9 years, they are all collecting the vaccine, and the vaccines are available in all our primary healthcare centers that are on immunization. They have been routine to the normal immunization processes. So a child can just walk into the immunization center and they collect the vaccine. You see, so it is no longer the issue of until you are age before you know of cancer. Those days we feel breast cancer until you are an old woman or whatever. But no, cervical cancer, they are trying to prevent using the HPV vaccine. So children need to know. And we are going to the schools was like, we even asked them, who have not collected that vaccine, and some are raising their hands, go back and tell your parents that the vaccines are still available in our primary health care centers where immunizations are taking place. So you should try and then go and collect. If you go to collect on a commercial basis, it's so expensive. You take like 3 doses and it's like about 65 to 70,000 naira per one dose.
Okay.
But something it was brought free of charge. At the point there was misconception that if a lady collects this vaccine, she will not give birth again. So we need to intensify awareness to the parents and even the school children themselves. We met them in the school, we talk to them with the hope that they will talk to their parents, and then we talk to the teachers to bring this on board during parent-teachers association meetings to ensure that every child, every girl of that age has collected that vaccine to prevent her from getting cervical cancer.
Oh, that's interesting, starting from the young ones. I know children have a way of impressing on their parents, and when they want to pass an information, you must listen whether you like it or not. But I'm concerned. Some of these cancers, how do we detect them? How do you know you have them, Mary?
Okay, first and foremost, there are those that you may not be able to detect them on your own because they are hidden. For the ones that are in the internal organs that will be coming from inside, you may not be able to detect them. That is why we say, once you feel anything, go for a check.
Okay.
In a normal society, or let me say in the Western world, part of their health care routine is a health check at least annually. Unfortunately, where we find ourselves, it is difficult to access that because most of the things we do in the health is out-of-pocket expenses. Our government is not sponsoring most of these things. So one of how to know that you have some of these things, you may not be able to dictate some of these things or diagnose and say that, okay, specifically this is it. But you might be able to say that, okay, I can see something abnormal. Know your normal. For example, the breast. If you are talking about the breast, the first thing for every lady, as soon as she's becoming a teenager, as soon as she started developing breast, is for her to learn how to do the self-breast examination. So you do the self-breast examination by looking at the mirror first, so that you see and know how your breasts look like normally.
Okay.
You know your normal. You see your body, you know your normal. When you see your skin is changing, you should be able to know that, okay, my hand, this is not the color.
Okay.
So you know your normal. When you look at your breast, you see the size, you see the color, you see the shape, and you see all the figures. You look at the nipple, and you touch the nipple, you know what it feels like. That is number one. That's physical examination. The next thing is now palpation. You can do that by yourself. You don't need to go to the hospital for the breast.
No, you hold on with that. We'll take a quick break, and when we come back, then you're going to show us or tell us exactly, explain further how we can carry this out, because it's quite interesting. If you are able to do it yourself, then you'll be able to dictate if there's any difference. And I think self-examination is something that we're very, very poor at, especially in this part of the world. Viewer, the program is still the Baroness, and we are talking about the World Cancer Day with the theme United by Unique. You're wondering why a theme like that? Well, we all are united. Everybody can come down with cancer. But that is not what we are talking about. We want to know how we can prevent it and what to do when somebody has it. How you and I can unite to take care of such persons. After the break, we will be back, and you get to know more. How to carry out examinations, how to check yourself, how to look out for those signs and symptoms that could be indications of something wrong. Stay tuned. We'll be back.
In our 2 weeks,
in a moment, you were God, and you are not holding. You have been broken, your innocence stolen. I hear you whisper underneath your breath.
doesn't know how to treat a woman.
I hear your
I said that to my daughter one day, that is this how you're going to go for your husband's.
I will send out an army to find you in the middle of the darkest night. It's true. Stay tuned to to the Baroness on PRTV Just every Tuesdays from 11 a.m. to 12 p.m. and repeats on Thursdays from 9 a.m. to 10 a.m. Cannot be covered. The Baroness, changing lives a day at a time.
That's exactly what we're trying to do on the Baroness for today, trying to change our lives and change our lifestyle, trying to ensure that you and I adopt a very healthy lifestyle so we can enjoy the life that is given to us freely by God. Before the break, one of our guests, Nicky Mariah Sambo, was talking about how you can check some of the signs and symptoms of cancer, and she said especially for the breast cancer, it is possible for you to check yourself. First of all, know your normal. So, do you know your normal? Do you know how you look like? You know, some people, especially in Africa, we are so ashamed of our own naked body, our own body. We don't want to look at it, you know. But can you expatiate further? Now you've told us know your normal. Okay, so what else should we look out for? And if we know our normal, then what should the abnormal be when we are to look out for an abnormal?
Okay, thank you so much for that question. Once you look at the normal, you know how the normal looks like on the mirror. The next thing is for a lady, immediately after your menstrual cycle, immediately you are done with your cycle, the next thing to do is to check the breast, to palpate. And in the palpation is that you touch the breast round. You touch it round from 12 o'clock, just the way your clock is, you look at the breast that way, the 12 o'clock, the 9 o'clock, the 6 o'clock, and the 3 o'clock. You palpate. Once there is nothing abnormal, that is fine.
What should you be feeling? What should you be looking out for?
So that is why the first thing is know your normal. So by the time you palpate and you know how all, there are things that feels like lumps, but they are not lumps in the breast normally. So when you know how you feel, if you feel something harder or something painful, that's to tell you that there is something wrong.
Okay.
There. And at times when you look at it, you will see that the color has changed. And at times when you look at it, you will see that the shape has changed. And at times when you press on the nipple, you see that something is coming out, brownish or even bloody. And at times there's something we call put orange, is a French word. Okay. It looks like the back of the orange. So once it looks like the back of the orange, you see the skin is just looking like the back of the orange, exactly how the back of the orange look like. So that, in fact, once you see that, just know that it's cancer. But you cannot just give a spot diagnosis. You go to the hospital and check. And for some other cancers, like the cervical cancer, sometimes you see irregular bleeding in between menstrual cycle, or bleeding more than the required number of days, more than your normal. That is why you must know your normal. And for some other cancers, some you see that it's abdominal pain. They will come down with, they keep complaining. For some other people, they will keep telling you that they have harshness of voice. Some people, because it's cancer of the throat. So for some other people, you just see that it's a wound or a sore that refuses to heal. So despite all treatment has been given and all these things, you will see that by the time it is evaluated, you see that they now tell you that, okay, you have cancerous tissues there.
Wow. You know, I'd like to talk about this self-examination. One thing that some people have is excess of fear. Yeah. You know, like when they see a small spot on their skin, they begin to panic. Don't you think that encouraging people to check all the time might actually cause problems? For instance, people who have health concerns like high blood pressure. When you see like a black spot on your breast, you begin to panic. Yes, and then you do it all the time. Imagine a week you're checking every day and you're seeing weird things and you start panicking. Don't you think that regular self-examination might not be too good for people who are predisposed to being too fearful?
Okay, not exactly, because the main thing for cancer is early detection. Okay. So for us to have early detection in this part of the world, the way we have in the Western world, is for us to now check. So when we check at all times, we'll be able to say, okay, we'll rule it out. By the time we get to the hospital, it may just be a normal lump that it will remove, and there's nothing. And sometimes it will not be that, okay, it's early stage of the cancer. And from there, the person will now get treatment. Because once the cancer is nipped at the early stage, the chances of survival is very, very high. But when we allow, because the cancer cells move from one part of the body to the other, we call it metastasis. So once there is that stage of metastasis, you see that the chances of survival has gone down. Then at the end of the day, the quality of life that person will now live, even before God calls that person, will now be low. So for us to just reduce all this, it's just for us to go in for the early detection. If we can afford health check annually, it will go a long way for us.
That's interesting.
Definitely.
Viewer, if you want to be part of the program, the number for you to call is on our screen. You can call us, your comments, your questions, your contributions, your concerns about our issue of discuss. Mr. Tokbish, you are creating awareness, and you're taking it to schools. But what about the marketplace? The marketplace and beyond the cancer awareness itself. Mariah spoke about our diet, our lifestyle, and in creating awareness, have you considered looking at the lifestyle that we have adopted and how we can change that mindset with regards to lifestyle? On the plateau, we have a lot of fruits and vegetables, which we do not eat. Sadly, most of us don't like it, don't like vegetables, don't like fruits, don't like a lot of things that we have here. And we sit back and think it is the rich man's food. In creating awareness, do you consider things like that, health concerns, issues of dieting, issues of lifestyle, exercise, and things like that, especially for younger children?
In our plan for the year, we have series of awareness programs that have been marked. For this cancer day was when I introduced the secondary school, the schools, and then the issue of getting to have the wives of the women chairman and this is our in place. But along the line, we have market and outreach programs that we need to go. We visit markets to educate them. We are also in collaboration and then try to see how we can assist the business of agriculture, PADP. The foods we eat today, they are part of the problem. Perishable foods, they use the spray, all these chemicals. Chemicals cannot be used on vegetables like spinach, cabbage, pepper, okra. Then you harvest tomorrow and then to begin to prepare. And then you go there to what? Put these chemicals. Application of chemicals in preservation of our crops. Our crops, yes. Our seeds like maize, beans, and all of that. Somebody might just put these chemicals with the hope of selling it maybe in the next 3 or 5 months so that when it got expired. But because the price of the goods just high up, they just pack the goods and they take it to the market. You're not minding the chemicals they apply has not been has expired. So we are working closely with the Ministry of Agri and the PADP to see that we sensitize farmers on the use of what? Chemicals on perishable goods to the market. Anytime you go to the market, the beans that was sold for 1,100 last year, they were selling beans 300 naira, 400 naira, then something is wrong. Okay. When the price of beans was going down, I was afraid myself. Because most people that stop these beans, put in chemicals, they have the feeling that, if you do this, this will cost 300 naira. So why not? Part of the will take to the market. Okay. So we have awareness of chemicals, of course, yes. So we have awareness for farmers, we have awareness for market women and men, we have awareness going around communities. This is now the community stakeholders to ensure that the information goes down to the grassroots. They are part of the plans for the year. Yes.
Prevention is better than cure. That is all good and well. But at the end of the day, realistically, there are people who have come down with cancer. Sometimes not because of what they did. Probably inherited or because of one factor or the other. Now, sadly, there's a lot of stigma attached to it. You mentioned a case of somebody having her breast cut off just to prevent it. Now, that is in an advanced country where she had the opportunity, she had support, and probably the finances to do that. It sometimes gets to the point where people are diagnosed with cancer, they just go back home, fold their arms and wait for whatever will happen because they probably do not have the finances. And as a society, people do not seem to help the situation. They look at you and they frown. Sometimes they blame you for coming down with cancer, saying that you caused it. They look at you like a leper. They run away from you.
Or admit around you when they say it's your village people, somebody that did it to you, and things like that.
Now, these are various concerns. It's actually very sad to note that a lot of people face these challenges. They cannot speak out. Please be their voices. As a society, what are we doing wrong? How can we ensure that we come together to aid them so that they do not cry in vain for something that is not their fault?
And responding, is cancer communicable? You know, people think it's just like a common cold.
You know, also we respond to this. Yes. Maybe we'll start from the ladies first. Yes.
Cancer is not a communicable disease. It's not at all. The only thing you can contact from such a person, that's if the person got cancer from any of those viruses or bacteria we're talking about. But cancer in itself is not a communicable disease. So we don't need to stigmatize them in our environment. They are our brothers, they are our sisters, they are our neighbors, they are our colleagues. So we need to be by their side. In Nigeria, honestly, we need to be more humane than we are, and in Africa in general. We need philanthropists in this nation. If you look at what is happening in the political realm and how some of our politicians or people occupying some offices are managing funds, you will see that if they can channel just 10% of that fund to some of these people, we will not be having some of the challenges we are having now. So we need more philanthropists in our society. Apart from that, we also need a scheme that can also take care of this in case anybody is coming down with such things, so that we can have early diagnosis and also treatment. Then, in line with what our president is doing at the moment, having 6 cancer zones, 6 cancer centers, the 6 geopolitical zones, which we are fortunate to have one on the plateau. This is something we should encourage our government to keep doing. There's nothing wrong in also having the state also having another center. We can have 2 centers on the plateau. There's nothing wrong with that. So we can also sponsor some of this treatment so that we can also encourage people to go for early detection and also people to understand, okay, what it is and the implication for staying back or going for alternative treatment. People have gone for alternative treatment, but I assure you that nobody has been healed from alternative treatment. Well, if somebody is comfortable with the alternative treatment, I will advise that the person also go for the medical care and also do that other one. That's if that other practice it is safe. Sometimes we also need to look at it with another eye. The fact that we always say, is your village people, is your uncle, is your auntie, that delays treatment in Nigeria. So when we come out and seek medical help, that's if we can afford it. Because you look at cancer has a way of also following people who can also not afford the care. So once you cannot afford the treatment, definitely before you even present yourself in the hospital, it must have gone advanced. Metastasis has taken place, quality of life has dropped, and so many other things. So we really need to do more in terms of humanity in this part of the world.
We need to do more, sir. I'm sure you have a lot to add to that.
The what we are planning to do more is one, to mount a very comprehensive advocacy strategy. The advocacy will start from the top. Government is spending so much money, even from the government house, giving people money to go and do cancer treatment around the country. Our elected, the senators, the chairman, and everybody in their communities, people go to them to seek for money to go for cancer treatment. Our advocacy then is, can we strengthen the cancer organization that is into prevention? If you talk about 100 people, sensitize them, they need integrity, they have gone for the checkup, the women go for the pap smear and TBI. The men above 40 years go to test for PSA, which is the prostate cancer.
You said pap smear. What's that?
Pap smear is the test conducted for cervical cancer. Now, and then is responsibility to do hepatitis B and C screening that causes cervical cancer. If all those ones are done, we will be able to prevent a lot of cases from even. And you know how difficulties are always due. We are appealing to the government of Plateau State to create more cancer centers. One, Plateau should make a cancer center. Two, every local government should have cancer-based officers. Collaborate with the local chairman and the primary care department to have a cancer center that will dedicate people. If there's a patient in one village, don't think of going to Jujut. We save you. Put there the problems and the protocols. She mentioned about the separate people. If there could be a cancer somebody in my village, fair. Not because she has discharge and going to Jujut. She can go to the local government. And you know, when they cannot do it, she could go to the hospital. When they cannot go to that Jujut, go to the Plateau State. It is for necessity. So you could just imagine how things will be there. So you can decongest the cancer centers, and then the advocacy and awareness cut across. I think we're going to go a long way.
But is cancer a death sentence? You know, I've heard people say
it's not a death sentence. You can actually everybody can come with cancer. I remember we have more than 100 types of cancer in our bodies. So if you get it through smoking or hepatitis or any other means, maybe you can inherit it. So who is above inheritance? Your parents have it, can you avoid it? You can't avoid that. So the bottom line is that everybody should get screened at the early stage. Go, if you're a man above 40, do your prostate cancer screening. Everybody should do his hepatitis B and C screening to know. And then this other women, ovarian cancer, cervical cancer, all those ones. If we go to check all these ones on time, I think. And you can be healed. Yes, there's treatment.
No, you will not kill you.
Yes, this case will actually save you. The sooner you know, the better. Because if it's detected early, it can be treated. It can be treated. And fortunately for us, we have the treatment mechanism here in Nigeria, don't we? Yes, we do. Yes, we do. You can be treated. And you can come out cancer-free when you adhere to the treatment regimen that is being prescribed by the doctors. So why don't we tell ourselves that this 2026 we are going to adopt a better lifestyle? We are going to adopt a better way of taking care of us. If you don't take care of this body, when the body decides to retaliate, there's nothing you can do about it. So better take care of it now. And the appeal that has been made to our food sources, the Ministry of Agriculture, is something that I think we need to loud. We need to loud our voices concerning that. You know, please don't add chemicals to our perishables. People like me, when I go to the market and I see fine looking tomato like this, I just want to buy it and wash it and eat. You know, but now, from what's been said, I have to think of how to wash it with salt water and vinegar and all that, make sure that I remove whatever chemical is on it before I can eat it. I don't know. I think we need to do something. You and I need to just join hands and make sure that our perishables are being treated the right way and herbicides, pesticides, so we can enjoy them. And when you eat good food with lots of fruits and vegetables, you'll be healthy. Exactly, you are what you eat. And the more you do that, I think the better for us. And this concern that we have about cancer, we would collectively bring down the numbers. Our guest, so for the awareness, how long is it going to be? Is it just for February, or is it something that we continue? And what can we do as individuals now? What can we do as individuals watching right now? How can we spread this?
Awareness has come to stay because rate at which people come down with cancer has doubled compared to what we used to have in society. So the awareness has come to stay. The awareness will not stop or continue the awareness in different cohorts. We started even with the nursery classes last week. Yes. So we're there, those in primary, secondary, tertiary.
Have you gone to grassroots?
Not all. We did the just metropolis. We are still doing the just metropolis, but we'll still go around so that everybody will get to know. The first thing is early detection. And please, we should not discriminate against anyone diagnosed with cancer. Let us also support. Let's support the person that's sick. Let's also support the caregiver. If you can't give your time, you can give your talent. If you can't give your talent, you can also give your resources. You can give your skills so that they will not feel the burden and now think that they are alone. Let that person not feel alone. We are united together, and together we can have a healthier society.
Wow. Interesting. Dr. Fish, closing.
We are trying to meet the gender commission because we've had cases of marriages breaking. Yes, a woman saw her husband with prostate cancer, so she left the marriage. How can you stay like that? Likewise, a man was breast cancer. So we want to do the gender commission, see how we can create more awareness. We want to collaborate with them and see how messages can go to the grassroots.
Wow.
This is quite an interesting topic. It's been an eye-opener, definitely. But there's good news. We're streaming this program live on YouTube. Yes, you can go to YouTube and locate this episode, as well as previous episodes of the Baroness. Just find us on PRTVC Jos. Our lines are blowing up, so we cannot be called. Do remember that you can drop us text messages within the week, and we will try to respond to you appropriately. Until then, remember, you are what you eat. Take care of yourselves, and your body will not fight back in the future. Yes.
Exactly. Take care of yourself. You are what you eat, and your body will not fight you in the future. You and I get united for other things. Why don't we unite for cancer and show love to those people who have cancer and do the best that we can to encourage ourselves to eat healthy, to live healthy, and most importantly, to check ourselves regularly. The better for us when we know early, because help is always available. Thank you so much to our guests for coming on the program. Nicky Mariah Sambo, thank you so much for coming, and Mr. Tokbish Mizak. Thank you so much for coming. Thank you so much for being a part of this program. Remember, cancer awareness month. What you know, you should also let other people know about it. And when you have cancer, please don't hide it. Just let us know. Talk to people about it. When you talk to people about it, you will get that support that you need. And when you know someone that has it, please do not discriminate. Do not segregate. Please give them the love and the support that they need. The Baroness is always there for you. If you need someone to talk to, you can reach out to us, and we will do the best that we can to be a support system for you. Thank you so much for coming, our guest. Thank you for being a part of the program. Thanks to the production crew and all the beautiful ladies behind the cameras today. Do have an awesome day.
If you feel about word for word, truth was well, without it's just the time, I'm gonna lie. I see you come, you're the dry.